Good evening. I'm psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have a chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here at the PBS Fort Wayne studios by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, I've been using artificial intelligence chat websites to ask therapy-like questions about issues I am facing in my day-to-day life. Is this something that can be beneficial, or should I avoid doing this? I think AI is going to improve with psychotherapy over the course of time, but realize that's not a real person with whom you're speaking. And unlike a therapist, that AI chat might not understand the context of your question. I've heard about disastrous type of results where somebody asks where the closest bridge might be because they want to commit suicide, and AI will give them the location of the closest bridge and not really go into the reasons why they might want to commit suicide and follow up on that. So you have to remember that AI is programmed to give you certain responses for certain questions, and it might be somewhat dehumanizing to do so, keeping in mind that you're not talking to a real person. So it's nice to have a therapist on the other end of the line. We're big advocates of telehealth, where you can talk to a real-life therapist by telehealth now for convenience. But there's a lot of merit to continuing to see a real-life person still for talk therapy. Thanks for your call. Let's go to our next caller. Hello, Shannon. Welcome to Matters of the Mind. Shannon, you want to know about the risk factors for suicide because your brother has been expressing suicidal thoughts every now and then. Shannon, if you've had previous suicidal thoughts, it does increase your risk for future suicide because the longer you're thinking about it, and more importantly, the more times you've attempted it, the more likely you're going to carry out a suicide attempt. So if your brother has had suicide expressions and had suicide attempts in the past, that actually puts him at a higher risk for suicide. A family history of suicide, a mother, father, brother, or sister having died by suicide will be a risk factor in itself. What often we'll hear when somebody has a sense of hopelessness, that's at the top of the list. When somebody has hopelessness and they've given up all hope on their life circumstances, that's when they often will end up thinking very seriously about suicide. And often that's followed by somebody having a significant loss in their life, whether it be a loss of a family member, a loved one, a loss of a job, a significant loss of some type will often trigger a sense of hopelessness and having difficulty looking beyond the current day. Anxiety will be a big risk factor. Some medications can actually cause people to be more restless and anxious. We call it akathisia, where they can't sit still. But if you're highly anxious, that puts you at risk for suicide, and going along with that, insomnia, having difficulty with getting to sleep and staying asleep. If you sleep well, it recharges your brain and helps you with the thinking part of your brain in the front. The thinking part of the brain in the front helps you cope and helps you put up with stuff. And if you can't recharge the thinking part of your brain, the logical part of your brain, you'll have a greater likelihood of thinking about taking your life and not looking at other alternatives in your current life circumstances. So that can be a factor as well. People who will have difficulty with impulse control and drink alcohol or use drugs of abuse will be at a higher risk for suicide, especially during that time. I've seen many people over the course of my career who got intoxicated. They used some kind of narcotic or some kind of drug of abuse, and they might make a suicide attempt, and the following day they wonder why they did it. They say, oh my goodness, I feel badly, but I would never want to take my life. Well, they did while they were under the influence of alcohol. So if somebody is suicidal, as your brother is described, I'd certainly make sure to get the alcohol out of the household, keep a close eye on him, take him seriously when he talks about suicide because he's trying to reach for help in doing so. But if he has any weapons in the household, try to get them out of the household or at least disable them at that time. Thanks for your call. Let's go to our next caller. Hello, Julian. Welcome to Matters of the Mind. Julian, you had mentioned that you are retired and widowed, and you want to know how to maintain your mental health. It often happens, Julian, as people get older, they retire, they don't have the regular job to attend day by day, they don't have the obligations, they don't have the socialization if they don't have the work environment. Then put on top of that, you lose your loved ones, not only your spouse, but also many times other friends are lost. And I often hear about older people looking in the obituaries, not because it's morbid, but because they're looking for their friends and people they might have known from the past. So it's a very lonely time for many people as they get older. I would first ask, Julian, do you have any grandchildren? If you have grandchildren, somehow, some way, whether it be within proximity or whether it be across country, somehow, some way, maintain some kind of relationship with your grandchildren. I remember seeing a study out of Berlin where it studied people over 70 years of age over the course of 30 years. So it could study them up to 100 years old. But these people were all grandparents. And if they were actively involved in taking care of their grandchildren or interacting with their grandchildren, actively involved, but yet not living with their grandchildren, that'd be a parent role. But if you were in that grandfather, grandmother role, and you're involved in your grandchildren's life on a regular basis, your longevity increased by 37%. And I always thought that was interesting because being a grandparent, being an actively involved grandparent can increase your lifespan, all other factors being considered. So grandchildren, yeah, they can have a significant impact on your mental health. Another thing you can do as you're retired, you're widowed, try to go exercise on a regular basis and do such exercise in a social environment. Socializing in general, not only with your grandchildren, but with other people would be very, very helpful for you at this point. Do the best you can to eat a healthy diet. I think your primary care clinician could look after that and make sure your blood pressure, your blood glucoses, your lipids, your overall metabolic profile is in good control. But if you have any difficulty with hearing, it's been shown that people who have a loss of hearing, as often happens as you get older, it will isolate you from other people because you can't hear what they're saying, but it will also increase your likelihood for dementia. So it's very important that if you have a loss of hearing that you get hearing aids so you can hear what other people are saying, and that way that keeps you actively involved in the world around you. Thanks for your call. Let's go to our next caller. Hello, Daniel. Welcome to Matters of the Mind. Daniel, you want to know about Cobenfy. And what is it? How does it work? Cobenfy is a combination medication of xanomeline. It starts with the X, xanomeline, and trospium. Trospium is a medication to offset the side effects of xanomeline. Xanomeline has been around since the 1990s. It was originally studied as an Alzheimer's medication by Lilly in Indianapolis. And it was studied as an Alzheimer's medication because it profoundly increases muscarinic activity, and that means acetylcholine. So basically, it increases the effect of acetylcholine in the brain. In doing so, it can help with memory, but the problem with the xanomeline when it was studied for dementia was that it increased acetylcholine all over the body, and it gave people horrific gastrointestinal problems because if you increase acetylcholine in the gut, it can give you nausea, diarrhea, and if it increases in the heart, it can actually slow down your heart rate. So it was intolerable for people. Well, it was kind of rediscovered a few years later. They started studying it for schizophrenia, finding that if you increased acetylcholine transmission, you could thereby decrease downstream in an appropriate way dopamine. So rather than directly blocking dopamine, you can decrease the firing of dopamine and thereby not having all the side effects that the traditional antipsychotic medications would cause. But what about the nausea? What about the diarrhea? Well, trospium is the second medication added. Trospium selectively will block acetylcholine in the rest of the body, but not in the brain. So xanomeline is able to do its thing in the brain and increasing acetylcholine without being blocked by the trospium. Trospium is affecting the rest of the body and blocking acetylcholine in the rest of the body. Cobenfy's been out for a year or so now, so it's been around for a little while. And it's getting used more extensively, but it's an alternative to the dopamine receptor blockers, the antipsychotic medications that have been used for the past decades. They worked, it's just that they caused a lot of side effects, and those side effects were predominantly from blocking dopamine, which Cobenfy does not do. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, can psychiatric medications cause or change dreams or cause nightmares for people who take them? Specific psychiatric medications that can cause nightmares will be medications like the beta blockers, metoprolol, atenolol, propranolol. These are medications that will block norepinephrine. And when you block norepinephrine in the front part of the brain here, you can enhance REM sleep and actually cause nightmares. So we sometimes hear about that. Medications that are used for migraines, slowing down the heart, decreasing blood pressure, and various other reasons. Beta blockers can be used in various capacities. They can cause nightmares. So I'm always going to look at the medications people are taking. Occasionally we'll hear about the serotonin reuptake inhibitors, such as Lexapro, Prozac, Celexa, Paxil, Zoloft. These are medications that increase serotonin, but indirectly they can cause nightmares for some people and give some people difficulty with dreaming in general. Historically, the medications we've used for depression have actually decreased dreaming, such that they will have a decreased REM sleep and thereby have a lessening of the nightmare effect. The old tricyclic antidepressant medications, nortriptyline, imipramine, amitriptyline, these are medications we use at low doses to actually prevent nightmares for a lot of people. So they can block REM sleep. So depending on what medication you're taking, some of them can worsen nightmares. They can actually enhance your dreams or actually block your dreams. But there are different reasons why we'll use different medications, and they will affect dreams in different ways. Thanks for your email. Let's go to our next caller. Hello, Kathy. Welcome to Matters of Mind. Kathy, you want to know how does a sense of smell affect your mind with stress and emotion? Smell has a very profound effect on the memory center, Kathy, because the sense of smell gets embedded in the hippocampus here, the temporal lobe part of the brain, the yellow part of the brain. And a sense of smell is one of the most powerful evokers of memory that you'll find of any of the senses you have. So that's why it can be very subtle. If somebody's had a traumatic experience and they smell something associated with that traumatic experience, it can profoundly cause them to have a lot of anxiety. They don't know why, but it's a sense of smell that can be very, very pronounced. Now, people will use aromatherapy, as they call it, as a means of getting themselves a calming effect. Some people are calmed by certain aromas, and that's perfectly legit. And it can be safe as long as the aroma itself is not an oily type of aroma that's going to coat your lungs. So you got to make sure that the aromatherapy that you're using is not going to be hazardous to your lungs themselves. But some people can be very calmed by certain aromas. We're getting into the holiday season now, and in the holiday season, people will often have good memories of certain smells, and it's always nice to have those smells around. So the sense of smell has a very profound effect on the memory center of the brain and can bring back good memories or bad memories in some cases. Thanks for your call. Let's go to our next caller. Hello, Marcus. Welcome to Matters of Mind. Marcus, you want to know, is it okay if your mental health team is only your psychiatrist? You feel like you get more out of those appointments than therapy? I think it's up to you, Marcus, with your psychiatrist. Typically, psychiatrists in the 21st century are going to be primarily in the role of psychopharmacologists. In other words, we're going to be prescribing medications, but we're also going to be diagnostically assessing people. So we want to make sure we get the right diagnosis, and based on that, direct the therapy. Therapists will often be social workers, psychologists, sometimes nurse practitioners can be in the role of therapists as well. So you'll have a therapy team, not uncommonly, but if you feel like you're doing well with your psychiatrist at this point and you're feeling like you're able to achieve your goals, do what you want to do in life, and keep moving forward, and you're only seeing your psychiatrist at this point, that's fine. It all depends on your personalized goals and what kind of treatment you'd like to see at this point. Thanks for your call. Let's go to our next caller. Hello, Zach. Welcome to Matters of the Mind. Zach, you want to know, are we currently facing a mental health crisis with a rise in anxiety and depression? It's an interesting phenomenon that we're seeing in the past 20, 30 years, Zach, because I think people right now are struggling with identity. And when I say that, they're struggling with who they want to be, what they want to do, and they're often comparing themselves to others based on what they see on social media. And it's very, very important that you have that baseline on identifying who you want to be and what you expect out of yourself. So unlike 30, 40 years ago, I think people now are more struggling with what they want to be in life, who they should be, and there's a lot of questions. I'm seeing a lot of people having a dissociation with their families. It used to be that people would have a very strong bonding with their brothers and sisters, with their parents, with their grandparents, and you'd have this multi-generational effect. And as I was mentioning earlier, with grandparenting, that's very, very important in terms of developing the personalities of young people. And you don't see that so much anymore because families are moving away from each other and grandparents aren't as involved as they used to be. I was reading about grandparenting not too long ago, and I found that in the animal kingdom, there are 4 species of whales and the Asian elephant who are actively involved in rearing their grandchildren, their grand animals in those cases. So 4 species of whales and an Asian elephant. And then we have grandparents as humans. So grandparents as human has a very important role, not for the purpose of reproducing more children, it's just more for the bonding and the social guidance of the grandchildren themselves. So I think all that put together is something that's very, very important as we go into the 21st century. I don't want to see our children in the future reared by the public schools or the governmental type of indoctrination that they could get. I'd rather see the families have a greater means of bonding and connectivity, and I think we're losing that as time goes on. So is that creating a more anxiety and depression? I hear about it because people get more anxious when they start to lose that sense of identity and having an understanding what direction they're going to go in life. Thanks for your call. Let's go to our next email. Our next email reads, Dear Dr. Fawver, is a caffeine supplement okay to use? I'm a college student and sometimes I have to put in a late night of studying. I get that. As college students, you often have to do that. And as a college student, I could advise you to be careful to still get your sleep. It's been actually shown that if you have a late night of studying and you're going into 2 and 3 in the morning and 4 in the morning and you have an early morning examination, you're not going to retain any more information probably after about 10 or 11 p.m. at night, even with caffeine. What caffeine does is it will basically allow you to recharge the brain and give the brain a little bit more wakefulness. Caffeine also indirectly will increase dopamine transmission. But caffeine is simply an adenosine receptor blocker. So when you think about adenosine, when you hear about ATP, adenosine triphosphate, then there's ADP, adenosine diphosphate. Adenosine is basically the fumes in the brain. The brain's working all day long and it's setting off fumes just like a car releases fumes from the engine. Adenosine gets released as fumes in the brain and it makes you tired as the day goes along. So what do? You can use some caffeine as a means of blocking the adenosine receptor so you don't feel as tired, you're more awake that way, but you're also indirectly increasing dopamine as well, helping with concentration. Where my stance is on caffeine is use it sparingly. If you overuse it, your brain gets used to it and you need more and more, then you get headaches and you feel lousy if you don't have the caffeine at a certain time. If you use caffeine, I don't recommend using it in the form of tablets. Tablets have about 100 to 200 milligrams of caffeine in them. Taking that as one gulp, as one shot, I think can give you a surge of caffeine, but that would wear off very quickly. Caffeine doesn't last very long in the body. So I would often recommend having a caffeinated beverage. The favorite caffeinated beverage I could recommend if it works for you is simply tea. Tea has a combination of caffeine and theanine in it, and it's a beautiful combination because the caffeine gives you a wakeful effect, the theanine gives you a calming effect. It tends to balance out the blood pressure that way, and it's a smoother effect overall. So if it works for you, hot tea, iced tea, some kind of tea would be very, very helpful as long as it's caffeinated. But coffee can be helpful if you sip it slowly over the course of maybe an hour or two. If you gulp down coffee, it's going to get in your system very quickly, just like that caffeine tablet, but it's not going to last very long. So sipping it slowly would be very helpful. But caffeine has a very useful role. It can be what we call pro-cognitive in terms of helping with concentration, helping with alertness, and it's fine to use as the day goes on. But as I often recommend to medical students who I teach, I tell them to take that late afternoon nap or early evening nap for no more than 30 minutes if you can get by with that. A brief nap, set an alarm if you need to, but don't go more than 30 minutes because a brief nap will recharge the brain. You typically, with a brief nap at the end of a long day, it'll give you enhanced non-REM sleep. It'll give you a little bit of dream sleep. Basically allows your brain to recharge. When you go into non-REM sleep, that's going to be a very deep sleep, and it's where your front part of your brain is at total rest. So when that front part of the brain is at total rest, it allows you to recharge. You're able to download memories into your hippocampus better, and 30 minutes is often all you need. It's called a power nap. Einstein talked about power naps for about 20 minutes later in the afternoon. It's very effective for helping with concentration and focus, much more so than even caffeine. So using a power nap with caffeine is particularly effective. There's something called a coffee nap. I just heard about that phenomenon a few years ago. A coffee nap is where you have a cup of coffee, then immediately go take a nap for 20 or 30 minutes. You're very energized and awake at the end of that 20 or 30 minute nap because the coffee's just starting to kick in at about that time and you've had your nap. So it's giving you a really nice synergistic dual effect that way. Thanks for your call. Let's go to our next caller. Hello, Yolanda. Welcome to Matters of the Mind. Yolanda, you want to know, is it possible to train your brain to think only positive thoughts? It's not only possible, Yolanda, it's very likely that you can in terms of focusing more on the positive, because if you do think about negative ruminations, it's like driving down the road and always looking in your rearview mirror. Now, sometimes it's nice to look in the rearview mirror, but if you're going through life like that, it's important to understand, okay, what's happened to you and how you can learn from the past. But if you focus on the negative recollections, it'll cause you to be more depressed. So, is it positive? Is it possible to have positive thoughts? You bet. Try to block out the negativity. Always look forward to something. And we also have things that we can look forward to doing, whether it be tomorrow, or it can be next week, or even next year. But always have a forward-focused mindset, because that will help you more with positivity itself. Something I'll often recommend for people to do is simply have a notebook where they write down the kind of things in which they're grateful. So it's a gratitude journal. And many people forget to remind themselves of all the gratitudes they have. They think about all the bad stuff happening in their lives and all the mean things people did to them, but they forget the kind of things in which they should be grateful. So having a gratitude journal where you simply write down 5 things in which you're grateful, write them down once a week, and just always remember the kind of things you're grateful for. Whether it be something as simple as still being able to walk around and have your physical health that you have, whether it be your friends, family, whether be that you have a job for the time, but focus on the things in which you're grateful. That's the sense of positivity that is really good for your mental health. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I have been seeing these commercials on television concerning tardive dyskinesia, also known as TD. Why are these medications used, and who is at risk for developing tardive dyskinesia? Tardive dyskinesia is a condition where your middle part of your brain, the movement part of your brain, is getting too much dopamine. It's called the substantia nigra. Substantia means body, nigra means black, so it's a kind of a black body in the middle part of your brain. And if you have decreased volume of your substantia nigra, you get Parkinson's disease. Many people have seen Parkinson's disease with the famous actor Michael J. Fox, but he has Parkinson's disease, too little dopamine. Tardive dyskinesia is where you have too much dopamine transmission, especially in that substantia nigra, and it makes you twitchy. So you have trouble with hard blinking, you have mouth movements, you move your shoulders abnormally, and you overall have tics and twitches. So it's from too much dopamine. How do you get too much dopamine? Well, if you block dopamine excessively with some antipsychotic medications, it can give you on down the line tardive dyskinesia. Who's at risk for tardive dyskinesia? Number one, if you use an antipsychotic medication that strongly blocks dopamine for a mood condition like bipolar disorder or depression, unfortunately, that can put you at a higher risk for tardive dyskinesia. Now, here's the good news. Not all of these so-called antipsychotic medications will block dopamine to the same amount. So ideally, you want a medication that's going to block dopamine less, but still work for depression. Why do we use these antipsychotics for depression? Well, antipsychotic medications added to an antidepressant can improve the likelihood of you getting a response to the antidepressant by 70%. So they're effective. It's just that if you block dopamine tightly, you can have the twitchy movements consistent with tardive dyskinesia. Women are more likely to have TD. Older people are more likely to have TD. If you also have type 2 diabetes, that can put you at a higher risk for tardive dyskinesia. And if you have early extrapyramidal symptoms where you're shaky from the antipsychotic medication and you have shuffling gait and maybe you have tightness of the limbs, it's called extrapyramidal symptoms. If you have extrapyramidal symptoms, you're 2.5 times more likely to have TD later on. So you're referring to the medications Austedo and Ingreza. These are medications that are on the advertisements, and they are the treatments for tardive dyskinesia. And I'm very grateful we have those treatments because some people get tardive dyskinesia. These are a means of alleviating those treatments. I am always a big fan of trying to avoid the TD to begin with, but if you have TD, you need something, and those are very effective medications for relieving the TD themselves. They typically can have a little bit of sedation associated with them, but what they are doing is basically increasing the breakdown of dopamine specifically and selectively in that movement center of your brain itself. Thanks for your call. I think I have another call available where I can answer in this last minute. Hello, Carlos. Welcome to Matters of the Mind. Carlos, you want to know what's a good age to start thinking about the quality of your memory? I think at any age, Carlos, if you're having trouble with your memory earlier on, it can be something as subtle as thyroid disturbances, diabetes, some kind of medical condition. If you're in your middle age period, maybe it's sleep apnea. There can be something else causing memory problems. And as you get over 65 years of age, depression, early dementia can be a factor. At any age, alcohol consumption or the use of marijuana can affect the memory. So I think it's based on the age you're in. But if you have any trouble with your memory at all, by all means, talk to your primary care clinician to see what can be addressed. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.